Of course, as we reached a rather somber point in the coronavirus, with better than 200,000 deaths now in our country, better than 1 million worldwide. We have Dr. Devi Nampiaparampil joining us right now. Doctor, very good to have you. We don't know what these additional measures the president is going to outline, but it comes at a sort of an ominous time here. I know the trend in cases and indeed deaths has been slowing, but when you hit big figures like this, people stop. What do you think of where we're going with this versus what's happening abroad, where they're looking at a spike in cases like in France and Spain, the United Kingdom, Israel, what have you?
Sure. Each country has different challenges, but I think for people at home, when you see these huge numbers, it's very intimidating, of course. But at the same time, we should stick to the basics, what each person can do at home. So definitely we know masks make a difference. Staying away from crowded areas tends to make a difference. Hand washing also makes a difference. So those are the things people can definitely do. But then if we look at other things and trends, I think each person can individually look at their own risks. Their risks of catching the virus, how high is the spread within their own community? Where could they potentially get infected if they were going to? And then their risk factors. So age and multiple medical conditions always come up. But if you have medical conditions, it's not just that you get labeled with the condition and that's it. You can think about what can you do to control your particular medical conditions. If you're a diabetic, if you can get your sugars under control, if you have other problems like heart disease and cancer, a lot of doctors are making telehealth available at this time. You want to try to get everything as controlled as you possibly can, and then weigh your risks from there. So as far as the U.S. goes, I think, some measures, of course, our numbers and our rate of increase are always concerning. But at the same time, our treatment measures seem to be working. I mean, the fatality rate, seems to be coming down in terms of the numbers of people that are getting infected. Our awareness of what's going on seems to be a little bit better. We're making progress every day. There's always new scientific breakthroughs. Even in the past week, there's been some announcements that maybe there's some cross-reactivity between the COVID virus and dengue fever. So some people, at least in Brazil, who have antibodies to dengue, seem to have a little protection. So we don't know if that will pan out or not. But as the world fights this together, we get more information.
Real quickly, Doctor, young people are okay increasingly with going back to work. Older workers, those more susceptible to getting the virus, remembering what happened in the earliest days where they were the target group, are not. What do you advise, and how do you advise, let's say, older or more health compromised patients?
Yeah, age is a factor, but I would say the health compromise is the biggest thing. So if, for example, with my patients, if they are at risk in terms of their immune system or certain medical conditions, if they have more respiratory issues, more cardiac issues, if they have cancer that they're actively fighting, then I usually write them a letter to try to get them some accommodations or something else at work. On the other hand, you have to think about what type of work you're doing, your risk, and the value. I mean, for example, I guess I'm younger, I'll just give myself that, but I'm younger. I'm in the third trimester, so the risk of having a problem from COVID is higher. But on the other hand, I weigh it against, if I don't go to work, what's going to happen to my patients or my employees? So sometimes it comes down to sort of an individual risk assessment, right? Like the risk and benefit of going to work or going to these things. But I think work is a little different than leisure. And we were just talking about fitness, but I think for some people, fitness definitely makes a huge difference in terms of physical and mental health. So I feel terrible for those gyms that are being shut down.
Yeah, it's widespread, to your point. Dr. Devi Nampiaparampil, thank you very, very much. Following all these developments, again, we do not know exactly what the president is going to outline and what these procedures or new measures might be, but they're coming in the next couple of weeks. Stay with us.